And then procedures, it goes all through the hospital. Fear-free is not just for the exam room, it's also for, say, animals going into surgery, animals having radiology procedures, lab work. There's a whole different way of approaching animals to make them more calm. So say my dog Marley is coming in to just have a routine exam and she's having blood work drawn. She's a Jack Russell Pug mix, so she is high energy and she doesn't like her feet touched, she doesn't like anything touched. But we use distracting techniques. You'll learn about some of them in the course for touch gradient, considerate approach. And for example, considerate approach is we make sure the environment is suitable for that animal. Just rush in and just like, hey, let me just hold you for an animal, for your blood restraint. We just go ahead and make sure that the environment is right. Then we touch slowly to the less sensitive areas and always have a hand on the patient, always maintain contact. And that helps get their stress level down. So it's not like, like when you're having an exam and all of a sudden they touch you, you're like, bleh. It really does help calm. We also distract with treats. So there's a whole variety of different types of treats that can be used to distract animals. And a lot of them come in and they may not be willing to eat because they've got their fear up. But there's in the program, we learn about treat ladders and how treat ladders, you start with, say, like a biscuit, and then you may move to cheese, and then you may move to prime rib. It all depends. Like, what is the, oh my gosh, I'm going to stop everything for that piece of prime rib. Whereas biscuit, I'm like, that kind of thing. But we use, we use treats, we use gentle control, which is a different type of restraint, which basically we start minimal. And as a technician for many years, at first I was like, ooh, how's this going to go? But it basically, you start minimal. You use towels, you use pheromones, you use touch gradient. So the animals are calmer. Traditionally, we would have moved right to a muzzle, hold them in position, and get the blood and move on. But now it's more, let's take our time, let's let the animal acclimate, let's use these towels, let's use these pheromones, let's distract them with treats, and it is amazing what you can accomplish by using these things. And so that's an example of, say, for blood work, where we can distract and we can draw the blood while the animal is, like, say, taking squeeze cheese from your hand, or if you need to use a basket muzzle because you have an aggressive dog but he's calmed down, sometimes we could take it right through the basket muzzle. There's all different types of techniques that are so exciting to learn about and be like, wow, this is a great way to practice medicine. This wants me to stay at work. I'm not struggling with animals. I'm not getting full of hair or anal glands. I am able to do this successfully, and he's had a great experience, and now I did, the client did. Now everybody's gonna come back and everybody's gonna be happy. So there's just so many different areas in the hospital that fear-free can be implemented. Even the smallest things make a big difference for the pets.